Welcome back to our talk with Dr. Chris Lewis, who is joining us from Northern England to share his thought on Spectral AI's DeepView burn diagnostic. Chris, what are the risks of either overdiagnosing or underdiagnosing a burn wound?
So accurate depth assessment is a key skill that we develop over the course of our training and we continue in our consultant career. But despite our experience, our accuracy in determining burn depth by eye is estimated at anywhere between 60 and 80%. So there's huge scope for improvement. And when you think that the vast majority of burns are assessed at the first point of contact by an emergency physician or generalist, then their experience is even lower, meaning there's a very high chance that the depth that they say it is will be inaccurate. And that's something that we consistently see in referrals to our service every day, that burns are poorly assessed both in terms of size and depth. The problem then is that there will be a proportion of patients that are unnecessarily transferred to my service for evaluation with the attached cost. And I think that's particularly pertinent for those traveling long distances or with different healthcare systems than us in the UK. So I'm thinking of the US or Australia. But equally, there's going to be a subset of patients that should have been referred immediately because it's a significant and deep burn, but they're not because the depth has been incorrectly evaluated. Those patients are then have dressing care locally until a time when the overseeing physician realizes, hold on, this should be healed by now. And then the patient is referred late. They've had prolonged painful dressing care, potential infections, late surgery, and the resultant scar as well. So there's real problems at that first point of contact in terms of the accurate assessment of a burn injury that can persist.
Okay, multispectral imaging is a great approach to evaluate biomarkers, and it actually looks at a number of them, and a few that come to mind is kind of oxygen content, blood flow, and there's some others as well. What are some of the main factors, biomarkers that multispectral imaging is able to detect, and why are they important?
Okay, so spectral imaging uses visible and near infrared wavelengths of light, which are shone at the wound, and then the light remitted by the tissue is detected by multiple cameras that are within the handpiece. That's then fed into a wound healing algorithm and analyzed. So you can split spectral imaging further into multispectral imaging and hyperspectral imaging. Multispectral imaging, which is what we see here, captures this biological information from multiple layers of the skin as unique spectral signatures, and they represent variations in blood flow, tissue oxygenation, and water content. And by analyzing these signatures that are reflected back off the tissues, it's possible to differentiate between a viable and non-viable or dead tissue, assess tissue perfusion, and also detect subtle physiological changes which can impact on wound healing long term.
And another question on the DeepView device, as you mentioned earlier, it can help non-professionals or non-experts make a much better assessment of what's happening. So with that in mind, what are the highest value settings for DeepView, and where can it offer the most benefit?
I think this is a very geographical question, and it's dependent on the healthcare setup in that country. So for us in the UK, I see the role of this device in healthcare economics, placing a device in each burn centre, streamlining decision making so that we as surgeons can have the data in our hands to support earlier decision making. Does this patient require surgery? And if not, can they be safely discharged, freeing a bed for another patient? It's a consistent problem in the UK that we have a limited number of burn centre beds that are needed by a high number of patients. So if we have a way to streamline the flow of patients through a burn service, then it will only be beneficial. Similarly, I want to maximize surgical efficiency, and early data on wound healing allows me to allocate patients to theatre lists earlier. Thinking more broadly for burn services that cover a large geographical area, so I'm thinking about the very limited services in Australia that cover huge areas. I think the real win is going to be placement in referring sites, which is going to allow the referrer to capture data, send it to a specialist, and it will allow collaboration and joint decision making as to whether a patient needs to be repatriated a long distance or whether they can be managed with remote advice closer to home.